It started, so welcome. We have a very interesting topic for discussion and for presentation today, neurodegenerative diseases, something that can be very interesting for a lot of people. And for that, we have with us, and I have the pleasure to have with us, the Dr. Véronique Renard, that many of you know already, some others you are new, it's the first time. I think it's your case, Jan. I think for Rob, that's just joined us now, is the same thing. Hello, Rob. Welcome. Hey, yeah,
Hello.
your mic is locked. No. Don't worry. Okay. Anyway, as I was saying, so very interesting topic for today. Veronique, I take
I
the
just need you to.
yeah.
I cannot share the screen right now.
Right. Sorry. Let me just stop here. This one.
Yeah.
Give it.
So maybe.
Yeah, and I'll give you access straight away.
Yeah.
Da, da, da. Okay, it should be good now for you.
Okay.
Yeah, so it's all yours.
Okay. Thank you. So I will share the screen. So normally you should see. You should see. I will be info screen. So can you see my screen?
We can see your screen, and now we can see it on big format. So
Okay. So today we're going to speak about neurodegenerative disease. So basically, I won't be able to speak about all neurodegenerative disease, of course. So we will focus on Alzheimer's disease and Parkinson's disease. Why? Because it's the two most frequent neurodegenerative disease. So the idea is really to give you some key figures, so the prevalence of the pathology, the definition, and we will go into the physiopathology because it will make us understand the interest of stem cell mobilization and other natural solutions. So we need to explain a little bit the physiopathology and just have a look at the symptoms, the risk factors for both pathologies. And after we'll present you the preclinical data and the clinical data on stem cell mobilization for both pathologies. So we will see if there is any data for this stem cell mobilization. And we will also see the common hallmarkers of neurodegenerative disease that will explain why the natural solutions such as stem enhance, plasma flow, and selective are relevant for this type of pathology. So for the first one, I will give you some key figures of Parkinson's disease, why we are talking about this neurodegenerative disease. In fact, it's the fastest growing neurological condition in the world. Because as you see in the graphs, we have a lot of more and more cases. So it was 2.6 million of people with Parkinson's disease in 1990. In 2015, it's 6.3 million, expected to increase to nearly 25 million by the year 2050. So we can see that the increase is really exponential, I would say. And but right now we have 10 million of people who have the condition worldwide, 1.1 million people in the US, and around also what we can see is that it's expected to rise worldwide in the next year. So we know that there is 15% of patients with a genetic factor. The men are 1.5 times more likely to have Parkinson's disease than women. So there is a risk factor around the gender. We have also what's important to know is that the ages range for the diagnosis is between 50 to 65 years old. And 3% of the adult population is affected right now, but it's expected to increase. So what is really the definition of Parkinson's disease? It's a progressive degeneration of the dopamine neurons in the brain. And dopamine is a neurotransmitter that is involved in the control of many functions, such as voluntary movement, cognition, motivation, affect. That is why we don't have only motor symptoms, but we have also non-motor symptoms we will see, and it's based also on the role of this neurotransmitter. In fact, this neurodegenerescence is also associated with three key phenomena. The first one is an accumulation of a specific proteins, and it's a cluster called Lewy bodies, and it's consisting in protein alpha-synuclein. So we have an aggregation, an accumulation of these proteins that will generate the degenerescence of the neurons, dopamine neurons specifically. There is an abnormal activity of the mitochondria. So the mitochondria are the power plants of they are producing the cellular energy. And there is an inflammation of the brain tissue, specifically linked to several types of immune cells. So there is an activation of the microglia with an accumulation of immune cells that will also trigger the production of pro-inflammatory factors such as cytokines. The dopaminergic neurons are specifically located in the substantia nigra, so the nigrostriatal region. And this region is specifically responsible for the coordination of movements, and if they degenerate preferentially and massively throughout the evolution of Parkinson's disease, that will explain and trigger the motor symptoms. What is important to keep in mind is that it's not only the dopamine neurons that will degenerate. We have also, as the disease progresses, several neuronal population associated with other neurotransmitters such as serotonin, acetylcholine, norepinephrine, that will be also affected. That is why if several neurotransmitters will be affected, such as serotonin, for example, it will also explain the mood change, for example, the non-motor symptoms. In terms of physiopathology, so we have, as I said, some genetic mutation. It's not the majority of the cases, it's 15% of the cases, but some genetic mutation can lead to the protein aggregation, especially the alpha-synuclein aggregates. They will also trigger the mitochondrial dysfunction. What is important also is the fact that environmental toxins, such as pesticides, heavy metals, can also increase the oxidative stress and the mitochondrial dysfunction. This will raise the quantity of reactive species to oxygen that will potentially lead to the death. So the apoptosis, the neurodegeneration. We have also, as we know, the oxidative stress will also trigger, and I would say, will also trigger the neuroinflammation. So there is neuroinflammation will also trigger oxidative stress. So both phenomena are linked and will also contribute to one another. And this activation of the microglia will also, by the immune cells, will release cytokines and chemokines and contribute to the neuroinflammation. And this neuroinflammation, this oxidative stress, will trigger the cell apoptosis, the neuron apoptosis, and this neurodegeneration. So it's really something that is important to keep in mind is also in this physiopathology, the oxidative stress that is present, this mitochondrial dysfunction and neuroinflammation. This trigger the fact that there is motor symptoms because, as I said, dopamine is linked also to the coordination, the movements. So we have motor symptoms, slow movement, for example, so the bradykinesia, tremor, involuntary movements such as dyskinesia, rigidity, trouble in the walking, imbalance. And we have also non-motor symptoms because dopamine, serotonin, acetylcholine that can also have the neurodegeneration are involved in this non-motor symptoms because they are linked to cognitive function and mood change, etc. So in terms of non-motor symptoms, it's not, it's really frequent. For example, we have 50% of patients that have pain. We have 40 to 60% of patients that have dementia, sleep disorders, depressive symptoms, or constipation. So it's really, these non-motor symptoms are really important in the pathology. It's not only the motor symptoms. So it's important to keep in mind this this knowledge of Parkinson disease. So as we know, there is some genetic factors that can explain the development of the pathology. We have the age. In fact, the majority, as I said, is between the diagnosis is between 50 and 60. It's really as we age. There is also an increase in oxidative stress and inflammation that will also contribute to the pathology. As we know, men are more affected than women, and also the environmental exposures of pesticide, toxins, heavy metals can also increase the risk of the pathology because they will also contribute to the inflammation and oxidative stress. So that was really the presentation of the Parkinson disease. As I said, the physiopathology, the definition, the symptoms. Now we will see the data for Alzheimer, the presentation of Alzheimer's disease. So it's the first neurodegenerative disease in terms of prevalence. We have 7 million people in Europe that live with Alzheimer's disease. Nearly 5 million Americans that are age 65 and older are living with this Alzheimer dementia today. And as the population is rapidly aging also, the number is expected to rise to 14 million people by 2030. And what we know also is that the percentage of people with Alzheimer's dementia increase with the age. For example, 5% of people from 65 to 74 years old have the Alzheimer's dementia. The prevalence is increasing to 13% for 75% to 84 years old. So as we age, and for people with from 85% years old have as 33%. So we have 33% of the people age 85% or more that have Alzheimer's dementia. So we can see that really the prevalence is increasing with the age and is expected also as the population is aging to increase. In terms of physiopathology, as we have in Parkinson's disease, we have a protein aggregation. That is an accumulation of beta amyloid. So it's some plaque of beta amyloid. And we have also an accumulation of tau proteins that contributes to neurofibrillary tangles. So there is an abnormal accumulation of these two, of this protein and of beta amyloid. The accumulation of beta amyloid peptide is believed to trigger a cascade of events that ultimately lead to neurodegeneration. There is an abnormal phosphorylation and aggregation of tau protein that will impair mitochondrial transport along neuronal axons that lead to local energy deficits, oxidative stress. And this oxidative stress will also contribute to the formation and accumulation of beta amyloid and will also amplifying this neurodegenerative disease. As we have a beta amyloid aggregates, it will disrupt synaptic function impairing neurotransmitter release, reducing the synaptic also density, and interfering with synaptic elasticity. And we have a common physiopathology with this neuroinflammation, this mitochondrial dysfunction that is also present in Alzheimer's disease. And we have also a reactive microglia that is present in Alzheimer's brain and a cortical atrophy. So in terms of symptoms for Alzheimer's disease, we have confusion with time and place, irritability, mood change. We have also a difficulty completing familiar tasks, memory loss, trouble in conversation, so called aphasia. We have wandering, misplacing things, vision problems, poor judgment, and trouble planning. So it's really a cognitive dysfunction. In the mild stage, we have really memory loss and speech difficulties and mood change. And with the evolution of the pathology in moderate stage, we start to have learning impairment, aggression, dementia that is also present, and an impairment of daily activities. And in the severe stage, we have patients that are really bedridden with motor also impairments. In terms of risk factors for Alzheimer's disease, we have the age, as we know, genetic factors, family history. And in terms of modifiable risk factors, we have traumatic brain injury, lack of physical activity, disbalanced diet, smoking, sleep trouble, hypertension, cardiovascular disease, air pollution, this type of also risk factors that are identified for Alzheimer's disease. What is interesting is that for these two pathologies that are really the most prevalent neurodegenerative disease, we have common physiopathology. We have neuroinflammation. We have also a mitochondrial dysfunction. We have also oxidative stress. And we have an accumulation of proteins. For Parkinson's disease, alpha-synuclein. For Alzheimer's disease, we have beta-amyloid and tau proteins, but it's a common physiopathology. All this physiopathology will lead to, as we said, neurodegenerescence, and more for Parkinson's disease, more dopamine neurons that are disrupted. But we have really this common physiopathology. So, and two main markers are really oxidative stress and chronic inflammation that are really the common denominators of this neurodegenerative disease. Oxidative stress are really consequence on beta amyloid and tau accumulation for Alzheimer's disease, decrease antioxidant defense, production of reactive species to oxygen, and DNA damage, protein damage, and lipid oxidation. Oxidative stress will lead to also alpha-synuclein accumulations for Parkinson's disease, altered dopaminergic metabolism, mitochondrial dysfunction. So we have really, it's really a main contributors of the physiopathology. And we have also the inflammation that will contribute to the microglia activation, increased pro-inflammatory cytokines, increased beta amyloid for Alzheimer's disease. And the inflammation in Parkinson's disease will also contribute to dopaminergic neuron loss and damage. So we really need to keep in mind these common denominators of both pathologies in the nutritional strategy. Now I will present to you the preclinical data and the clinical data on stem cell mobilization. So we'll begin with Alzheimer's disease and a summary of the preclinical studies. So Alzheimer's disease on animal, mainly rodent models of Alzheimer's disease. It's with an injection of stem cells. The majority is mesenchymal stem cells. And we have, several benefits. So the first one is to reduce the neuronal death, and there is an increase of endogenous neurogenesis. There is also an increase in hippocampal synaptic density and a reduction of the beta amyloid level. And this attenuation of beta amyloid level will also attenuate the hippocampal, so apoptosis. So also what we can see is that stem cell, as we know, can differentiate into fully functional neurons. That will explain also the regenerative process and the increased endogenous neurogenesis and the reduction of neuronal death. Also, we have benefits also on spatial memory that is improved learning capacity, that is really linked to an improved cognitive function. So the fact that we have increased neurodegenerative, improved neurogenesis, a reduction of the neural death, and a decrease in the neuroinflammation will lead really to an improved cognitive function. In Parkinson's disease, we have several rat models where there is an injection of 6-hydroxydopamine to induce the same type of lesion that is present in Parkinson's disease. So it's really a model that will trigger Parkinson, as we have in humans. And what we know is that the stem cell mobilization and by stem cell injection will restore dopamine neurotransmission, improve the motor behavioral defects. It will also, as we have seen for Alzheimer's disease, it will also enhance the neurogenesis. Stem cell will also differentiate into dopaminergic neuron. It will increase the density of dopaminergic markers in nerves, terminals, and cell bodies. It will also be linked to an improved memory functioning, a recovery of motor function, and an upregulation of anti-inflammatory cytokines. And it will also increase the dopamine level. So we can see that there are really several benefits to stem cell mobilization in rodent model of Parkinson's disease. So there is really this differentiation into neurons that will help to restore the dopamine level and improve the motor symptoms and memory functioning. And we have also a secretion of growth factor that would also support the regenerative process. So now we will see some clinical data. The first thing that is really interesting is that in Alzheimer patients, especially in early Alzheimer dementia, we have a decreased number of stem cells in circulation. So that will suggest that there is an impaired capacity of repair and regeneration. And it's significantly correlated with age. And also there is a significant correlation between the number of circulating stem cells and the beta amyloid. So that's the first really interesting findings, is that there is a decreased count of stem cell in circulation in early Alzheimer dementia that is really linked to, as we said, an impaired capacity of repair and regeneration. Now we will see not only the number of stem cells, but the impact of stem cell mobilization. So it's really several clinical studies. Sometimes it's pilot clinical studies, such as this one on 7 patients with Parkinson's disease, age from 50 to 69 years old, with the stem cell transplantation. So we increase the number of stem cells. in circulation, and there is a significant improvement in the Unified Parkinson Disease Rating Scale, so the UPDRS. And this UPDRS scale is assessing several subscore. The part 3 is the motor symptoms. The part 1 is the cognitive symptoms that are really the two main parts. And we can see that there is an improvement in the part 3 of this UPDRS, so this Unified Parkinson Disease Rating Scale, that suggests an improvement in really the motor symptoms, both in off score and also on score. So we can see that there is an average changes of 9.5 points for the off score and 4.3 points in on score. And there is also an improvement in the EUN-YAR stages that really measure the evolution of Parkinson's disease that is improved for 4 patients. There is a second clinical study on 18 patients with advanced Parkinson's disease with 4-time transplantation and 3 doses, 1.5 million of stem cell, 5 million of stem cell, or 15 million of stem cell. And in 16 patients out of 18, we have a significant improvement in this Unified Parkinson Disease Rating Scale. So there is an improvement in the total score that leads to a significant improvement in symptoms, both motor and non-motor symptoms, observed at all times, starting from after 3 months and sustained after 12 months. And we have the most substantial improvement was observed at month 6, with a mean reduction of nearly 20 points. That is really a clinically relevant difference. In the third clinical study on 36 men and 14 women, so it's with a larger group of Parkinson's disease, they have a mean duration of Parkinson's disease of nearly 9 years. And we have a transplantation of stem cell. The patient showed a median improvement of 50% on the UPDRS score. So it's really a clinically a relevant improvement. They have also significant improvement in disability, activities of daily living, depression score, and quality of life. So we don't have only improvement in motor symptoms, but also in non-motor symptoms such as depression. In another study on 21 patients with Parkinson's disease, aged from 42 to 75 years old, with a transplantation of stem cell, we have an improvement in the Unified Parkinson Disease Rating Scale, and we have also a significant improvement of the EUN-YAR score, which is really assessing the stages of the pathology. So that's also confirm the consistent improvement in UPDRS score, which is really a validated questionnaire to really assess the motor symptoms, the non-motor symptoms, especially the cognitive also function. That is really an international validated questionnaire. And also, as we said, the EUN-YAR, which is really also used by healthcare practitioners and scientists to really assess the stages and the evolution of Parkinson's disease. We have also another pilot study on 7 patients with Parkinson, with a mean duration of disease of 15 years, with a single dose of stem cell, mesenchymal stem cell, and we have significant improvement in both off and on state of the UPDRS. I would say the improvement is really higher in off state than on. as seen on the graph, but we have significant improvement of the UPDRS score. That is really the rating of the symptoms. And we have also improvement that is found on symptoms such as facial expression, gait, and freezing episodes described by the patients also. We will see now for Alzheimer's disease. There is a clinical study on 50 Alzheimer patients with 25 or 100 million of stem cell that is transplanted compared to a placebo group. And we have a significant improvement after 35 weeks in the composite Alzheimer's disease score that is measuring also the symptoms. We have also an improvement in the Montreal cognitive score called the MoCA total score after 16 weeks, 26 weeks, and also 39 weeks, whatever the dose is. So we have significant improvement for both doses, the low and high doses. We have also a significant improvement in the mini mental state assessment. So it's a questionnaire also measuring the cognitive function. And we have also significant improvement for the highest doses at 39 weeks. So we can see that there is also an improvement in the composite Alzheimer's disease score and an improvement in the cognitive function assessed by 2 different validated questionnaires. We have also the stem cell mobilization is also linked to it's also slowed the decline of the whole brain volume compared to placebo by 48% for all treatment groups. And also, it slowed the decline of the left hippocampal volume by 61%. It also reduced neuroinflammation. So we can see that we can summarize that the stem cell mobilization will improve the capacity of repair, of regeneration. It will, the stem cell can differentiate into neurons. We have also a secretion of growth factors with neuroprotective action, and we have also anti-inflammatory action. And we have seen that consistently that for both Parkinson's disease and Alzheimer's disease, there is an improvement for Parkinson's disease, the UPDRS score, measuring both motor and non-motor symptoms. And for Alzheimer's disease, there is an improvement of the composite Alzheimer's disease score and also an improvement of the cognitive function measures assessed by, as we said, the Montreal cognitive score and the mini mental state assessment. So we can see that there is clinical benefits to stem cell mobilization consistently across the studies for both for the main both, I would say, neurodegenerative disease. And there is also an interest in antioxidant supplementation because, as we said, there is oxidative stress both present in Alzheimer's disease and Parkinson's disease. And we have also a total antioxidant capacity that is reduced, especially for Alzheimer's patients and Parkinson's patients. And Alzheimer's disease patients are also deficient in antioxidants, vitamin C, vitamin E, beta-carotene. So we can see that there is an impaired capacity of endogenous antioxidant capacity. As we know, oxidative stress is linked to this degenerative process, mitochondrial dysfunction, neuroinflammation. So the idea is really to decrease this oxidative stress by a supplementation in antioxidant. So in terms of nutritional strategy, the first one will be to have, as we have a clinical benefits of stem cell mobilization that is seen with stem cell injection, is to naturally mobilize stem cells to increase the number of stem cells in circulation to really promote this capacity of repair and regeneration. So Stemness Ultra will contain 3 different stem cell mobilizers. The first one is an extract of Aphanisominion flossaqua, so the Stemness, that will 1 gram of Stemness will trigger the increase is in the number of stem cell 1 hour after the injection, with a 30% of 30% of increase in stem cell in circulation, corresponding to 3 to 4 millions of new stem cells in circulation. We know that there is a specific mechanism of action. In fact, Stemness will inhibit L-selectin. L-selectin, in fact, is responsible for maintaining stem cell in the bone marrow. So if we inhibit L-selectin, there will be a higher release of stem cell in circulation. So it's really a complementary mechanism of action between the 3 stem cell mobilizers in Stemness Ultra. We know that this stem cell mobilization by Stemness will have several clinical benefits for ankle injury, for liver fibrosis, for diabetes. So we have also several clinical benefits that really will illustrate the clinical benefits of stem cell mobilization. So what we know also with Stemness Ultra is that we have a second stem cell mobilizers from wakame, from Ondaya pinnatifida. It's an extract that is standardized to fucoidams, to 85% of fucoidams, with antioxidant inflammatory action. And this extract of wakame, standardized in fucoidin, will progressively increase the number of stem cells after 4, 8, and 12 days. And so this increase of stem cell in circulation is also correlated to an increase in circulating SDF1. And we know that SDF1 will bind to CXCR-CAD, which is really the receptor at the surface of stem cell. And it's a guiding molecule, because the gradient of SDF1 will guide stem cell to the tissues. So it will also improve the migration of stem cell to the injured tissue. And the third stem cell mobilizers is spirulina extract, especially the yellow fraction called mesenchyme. It's a low molecular size fraction. And this yellow fraction, mesenchyme, will increase the concentration of GCSF. And GCSF is the signaling molecule that trigger the release of stem cell from the bone marrow. So we have 3 different stem cell mobilizers with 3 different mechanisms of action: L-selectin inhibition, GCSF signal increase, and SDF1 increase, to really promote this stem cell mobilization. And we know that this stem cell mobilization will have clinical benefits to really support cognitive function and brain health, brain regeneration. So we have the first, I would say, strategy to stem cell mobilization, for stem cell mobilization. And we already observed the clinical benefits for Parkinson's disease and Alzheimer's disease, especially with clinical benefits for cognitive function and motor symptoms for Parkinson's disease. And the second strategy will be to reduce this oxidative stress that is present in both neurodegenerative disease with an antioxidant supplementation. We know that oxidative stress will increase with aging, with hypertension, with metabolic disease, and is also present with Alzheimer and Parkinson disease. It will trigger, as we know, mitochondrial dysfunction, promote inflammation, trigger DNA damage, protein damage, and also vascular damage. And so the strategy here is really to decrease this oxidative stress with supplementation in antioxidants. So plasma flow will provide several antioxidants from sea buckstorm, cocoa flavanol, hydroxytyrosol, which is a polyphenol from olive extract, and astaxanthine from algae, Hematococcus pluvialis, and we have also 3 extracts that will contribute to vascular health, especially ginkgo biloba, asparagine from citrus, from lemon, and Centella asiatica. It's also important to have support in vascular health, because if we have a vascular health, for example, that the vessel, the blood flow is decreased, for example, or the vessel has, the elasticity of the vessel are impaired, we will have a decrease also of the blood won't circulate properly, and the stem cell won't reach the tissue in need. So it's also to support the stem cell activity, to support the vascular health. The second, what is important is really to have this antioxidant action, this vascular integrity, and also fibrinolytic action to really support blood flow, to really have an optimal blood circulation, a provision of stem cell and nutrient in the cell, to really support also normal stem cell function. The third nutritional strategy is also to reduce this inflammation that we know that is also present in both Alzheimer's disease and also Parkinson disease. So what we know is also that this chronic inflammation will also secrete pro-inflammatory agent, and this pro-inflammatory agent will alter the binding of SDF1, which is really the guiding molecule of stem cell, because the binding of SDF1 with stem cell, especially at the surface to S6CR4, won't be possible, and so there will be a dysfunction of stem cell because the migration of stem cell will be altered. So if this chronic inflammation will really trigger a low capacity of repair, and we know that this chronic inflammation is also present in Alzheimer and Parkinson disease. So the idea to really reduce this chronic inflammation is to provide a spirulina extract that is standardized to 30% of icosahexaene, which is really the blue pigment of spirulina, of blue-green algae. And specifically, this will have an anti-inflammatory action. How? We know that inflammation is also linked to the activity of several enzymes, COX-2 and 5-LOX. They will produce from arachidonic acid several pro-inflammatory agents, thromboxane, prostaglandins, leukotriene before, that will really promote this inflammation. And what we know is that specifically Cyactive will have this anti-inflammatory action because the ficocyanin fraction will inhibit the activity of COX-2, and the non-ficocyanin fraction will inhibit 5-LOX. So we have this natural anti-inflammatory action. And also ficocyanin are also a natural antioxidant action. So its active is 5 times more concentrated than the whole algae. There is a natural, as we know, anti-inflammatory action. with inhibition of two pro-inflammatory enzymes, COX-2 and 5-LOX. And this anti-inflammatory action have clinical benefits in 3 clinical studies, especially for joint function. But it was just to also mention that is clinically tested with an illustration of the anti-inflammatory action for joint also else. So to promote and to support this cognitive function and this brain health through also the support of regeneration and repair system. So the idea is to have 4 capsules of Steminence, so 2 capsules in the morning, 2 capsules in the evening for the repair system and the renewal of brain cells. An antioxidant supplementation to really decrease this oxidative stress with 2 capsules of plasma flow in fasted state, preferably in the morning, so outside meals, I would say at least, and 2 capsules of Cyactive to really decrease its chronic inflammation. So that's the nutritional strategy to support brain health. So thank you for your attention. I don't know if you have any questions.
Yeah, probably yes. Thank you so much, Dr. Trainard, for the explanation about very important diseases that affect widely the population. Well, but let's go to the questions because I'm sure there will be some. I see that Ulrika was the first one to raise her hand. Hello.
First of all, thank you for your training, Dr. Veronique. Very interesting. I have a question about other brain disorders. Like I have ADD, attention deficit disorder. What would you suggest for people to take in this case?
It's attention disorder, you mean? Yeah.
Yes.
Yes.
Alors, what is interesting is that the first clinical studies on FA, on afanism floss aqua, was also on attention disorder. So the first clinical studies on AFA were conducted in children and adults with attention disorder. So preferably for the attention disorder, it will be Steminence because we have clinical data. It's the equivalent of 1 to 3 grams of AFA. So it's the equivalent of 4 capsules.
And
so yes, we have clinical data on attention disorder.
Yeah, so you say actually 4 capsules of Steminence.
Yes, exactly.
And autism? I don't have that.
For autism, we don't have really clinical data. I would say for Steminence, for stem cell mobilization in general. So I don't know if we have clinical cases of autism in the past, maybe, but for me, we don't have, I would say, enough data. I would say specifically for autism. There is no counter indication, but we don't have really efficacy data on this particular disease.
Okay, and then the last question, long COVID. Long COVID, you can have, of course, long...
I don't know if we have testimonies on COVID.
Yeah, we have a few.
I would say there is a support for immunity, of course, you know, for Cyactive and for Steminence. There is, it's really known about the immune support. I would say it will be logical to have benefits, but I don't know if we have testimony for long COVID.
We have a few but specifically on this group, which is quite new, there's not many testimonials generated yet by this group. So maybe you can give us your clinical perspective in terms of how can it impact it.
I would say it especially for spironolactone, I would say for Cyactive and for Steminence, because these algae extract not only on inflammation and stem cell mobilization, they have also, and we have documented it for Cyactive, is that it will support also several immune cell stimulation, NK cells and T lymphocytes and B lymphocytes. So we have data on the fact that will really promote immunity. So I would say if it promotes immunity, it can be beneficial for this type of infection. But I would say we don't have clinical data. We have more, it's more based on the mechanism of action, I would say.
All right. Thank you so much, Ulrike. I think the next one was Suzanne Scott Maxwell. Suzanne?
Hi, thank you very much, and thank you, Veronique. Just hopefully 3 quick questions. First of all, would more hydration and oxygen help the brain neurodegenerative disease?
Hydration
and oxygen.
Yes, I would say hydration. Yes, I would say as Parkinson disease and Alzheimer disease are, I would say, have cognitive impairment and sometimes are with dementia, they can be at risk of decreased hydration. That's something, yes, to keep in mind. That can be also a risk. So they can have also nutritional deficiencies. So it can be also interest to have a proper hydration with also several I would say micronutrients. So that can be also beneficial. But I would say it's more linked to, for example, interactive. For example, that can be also beneficial for them. So that's, but for oxygen, I would say oxygen transports, it's more linked if there is a decrease, an impairment of the vascular health. With aging, it can be the case. So there can be an oxygen transport that is a little bit altered, but I would say it's not the main physiopathological pathway that were described, but it can be also of interest to promote vascular health for proper oxygen transport and also for brain cells, and also to improve hydration if there is a risk of malnutrition or not a proper hydration in these patients. So yes, it can be also interesting to have, for example, Hydroactive for proper hydration. They have also nutritional deficiencies, so that can be also interesting.
Okay, thank you. Second one, plasma flow. Can you tell me what the maximum daily dosage would be? Not necessarily related to, this particular topic.
Generally, we don't increase the dosage of 2 capsules because it's not, in fact, the antioxidant capacity and the vascular health benefits, it's not necessarily, it's not proportional to the daily dose. Exactly the same for Cyactive. Generally, we don't increase, we really focus to 2 capsules. So I will suggest and advise to keep 2 capsules. Because it's not proportional to it won't, if we increase the dosage, it won't necessarily increase more benefits.
Okay, thank you. And my third question, I've been asked this by potential customers. They want to know, do we do any animal testing?
For STEM-EDEMS, there was some animal studies conducted, for example, in model of diabetes or model of liver fibrosis to really enhance or to demonstrate the benefits of stem cell mobilization in this type of animal model, because for safety reasons, you cannot necessarily do clinical studies at first. And it will also illustrate the mechanism of action. So generally, you do animal studies before clinical studies. And Cyactive, no, it was really only humans because there is the 3 clinical studies and in vitro data for immune support. No, it's only stem enhance.
Okay, all right. Thank you very much. End of my questions. Thank you.
Thank you so much, Suzanne. I'll pass the word to Rob, which is the next one raising his hand. Hello, Rob. Your micro is muted, so we can't hear you.
Okay, excuse me. Thank you, Dr. Veronique, for this interesting topic. You showed a sheet where we measured the increase of stem cells an hour after intaking. What are the results? I can imagine that it accumulate over the days or over the weeks. Can you say something in time, in a different time, like a week or a month, and you measure levels from the beginning up to other periods of time? Is there something that you can share about that? Or is there something measured?
In fact, for stem enhance, it was measured hours after, because sometimes it's not the same speed of action. For example, for stem enhance, it was really the increase in stem cell mobilization were really documented several hours after. And for wakame extract, it was more after days that we saw the increase in stem cell after 4, 8, and 12 days. So I would say what is also complementary is that it's not the same speed of action. But for stem enhance, we didn't document, in fact, it was not documenting the increase after days. But it's always, I would say, a balance between cell loss and cell renewal. So I would say what is interesting in stem enhance is that we can increase daily the number of stem cells. So we try to balance between cell loss and cell renewal. So I would say that we need to see that in terms of balance, and to increase daily the consumption will really try to balance this loss. But yes, we don't have a specific. It was documented for stem enhance after several hours after injection, and for wakame extract it was more several days after. But it really depends on the kinetics and the speed of action.
Okay, does it mean that you're actually helping your apoptose process to improve also, to get rid of your cells who are not healthy for the
I would say that it will compensate the loss, because as a stem cell can differentiate into new differentiated cells, for example, in brain cells, in heart cells, and whatever, as we have this renewal or repair process, depending on the magnitude and the need of repair, it will compensate the loss. So it's really a renewal that is done by a stem cell.
Yeah. So do we follow through the company, and I know it's not a clinical trial, but I can imagine that we're collecting testimonials overall for, maybe it's not a question for you, but just in general.
Yes, but we have, I would say that yes, I will present sometimes, the mechanistic process and the clinical data and what we have, science on the ingredient and on the product. But yes, after we have several testimonials depending on the pathology. We have testimonial for diabetes, for example. We have testimonial from athletes also. So we have several testimonials. So I don't know, yes, it's mainly if for French customers, but yes, we have some testimonials.
In Europe. So we have a database of testimonials that we feed regularly as we are collecting them, right? Which is growing in time. And we are planning to do two things with that, and not only increasing the number of testimonials as we develop and we have more people consuming the products, but also we are starting to do video testimonials, which are easier access to everyone. And at the same time, we are planning to create a Facebook group focus on testimonials so we can be shareable with anyone. Anyway, Rob, if you are looking for anything specific, all you need to do is to write us, or you can write directly customer service, or write us and just tell us what you're looking for. We will search on our testimonial base and we'll provide you with the testimonials that we have on the specific topic.
Thank you. The last questions are, when we have the background of all this information is so fabulous that you actually think, is the company thinking about bigger amount of studies about these products? Or I know it's really expensive to set it up and to follow it in a double-blind, placebo-controlled clinical trials, but I can imagine that can be an extra value. So
Yeah.
are there ideas about these
That's
things?
something that I can answer as well. Right. So obviously, you just said it also. Clinical studies not only are highly time consuming as they are expensive as well, but at the same time, Cyril always have a scientific background and curiosity to develop more and to know more about things, as well as we develop new products. So there is that intention, yes. I think in terms of rationality, in terms of resource allocation, because that's an important point when you are running a
Okay.
we need to keep some balance between the development and the growth of the business versus how much resources we allocate to this kind of thing. So I would say
I totally understand, but thank you.
So the intention is yes, definitely is on our scope. The timing depends how fast we can develop and we can create resources enough for that.
Okay, thanks a lot.
You're welcome. Well, right. Anyone else with questions for Dr. Trainard, Veronique Trainard?
Yes, me. Okay.
Who's talking is
Shani.
I done.
Yeah. Is what about the illness ALS? Because a lot of people here in the Netherlands has ALS. I don't know if you're familiar with this illness.
I know the pathology. We don't have really specific data on this pathology. So I would say what I present you is really the two main neurological disease. But we don't have specific data on it.
Okay. And for these diseases, is it a good idea for people to take a double amount of the stem enhance, say for 3 months?
Yes, generally.
And then cut it down to the normal dosage.
Yes, sometimes I advise for specific pathology, especially for neurological disease, and to really supplement at long term, more than 6 months or nearly 1 year, really to see, and to have, for example, for Steminence, to have 6 capsules per day. So 2 in the morning, 2 at lunch, and 2 in the evening. Okay. Really to promote this repair system, and really to promote the I would say the renewal and the repair of the neuronal cells, and but to keep 2 capsules of plasma flow and 2 capsules of active, because as I said, it's not proportional to the quantity. So there will be an antioxidant and anti-inflammatory at this dosage. But for Steminence, yes, we can increase a little bit the daily dose to 6 capsules. Sometimes we have a testimonial on more than that, but I would say let's keep I would say 6, for example, and there can be an adjustment after of the daily dose.
And then just my last question, say for instance you start using it at age 35. How much can you prevent yourself from getting these neurological diseases then? Can you really limit your chance of getting one of them?
I would say I would say we support the repair system and the renewal system. So we try to compensate as we age the loss and the fact that stem cell will the function of stem cell can be less efficient, you know what I mean? While we age, there is more oxidative stress. We have more chronic inflammation. So naturally, it's more at risk of neurological disease, because as we said, it's the main risk factor as we age. So I would say that we increase the chance to limit the development. We cannot say that it will prevent totally But we help, I would say, the compensation of this loss of cellular loss and this oxidative stress and chronic inflammation. So we try to compensate the loss of function really by replacing this loss of this natural cellular loss by increasing the number of stem cells. So I would say we try to limit the chance to develop this type of disease. It's not we try to support, I would say, the natural function of the body. We cannot really say that it will prevent 100% of chance, but we try to limit the risk as much as we can.
Okay, thank you very much.
Right, very good. Anyone else has any question?
Not from me, but thank you very much, Nuno and Veronique. I'm sorry, I do have to go now, but really enjoyed that. Thank you.
Yeah, we are about to end anyway. I just wanted to add something because someone here asked, I can't remember if it was Ulrika or you, Suzanne, that asked about autism. I think it was Ulrika at the beginning.
Ulrika, yeah.
All right. And yes, despite the fact that we don't have clinical studies or clinical data on that, as said Dr. Veronique, we have a few testimonials on that, and I have particularly one in my head of one IBO like you in France who has a daughter with autism, and she had huge behavioral problems, very unrested, very, over, how to say it in English, almost aggressive behavior in some cases. And she was supplementing her, especially with stem enhance in a quite interesting dosage. I think she was on the 6 capsules per day. I'm not sure about this. I don't want to lie. Well, I can go back and ask or to check. And the fact is, she was pleasantly surprised with the impact, at least on the behavioral side of the child. It's not like, the autism didn't disappear, of course, and many of the characteristics were still there. But it was very noticeable that in terms of behavior, aggressivity, that's decreased substantially after some time of taking the stem enhanced ultra, right? I mean, it's one isolated testimonial. As I said, we don't have clinical data specific on that. So, and we know each case is one case in these kind of situations. But yes, we have a few testimonials on that side that support the idea that there is a positive, favorable impact on a certain extent in autism cases.
I actually have one last more question. Isn't it possible that Dr. Veronique can just maybe in half an hour put it in much more simple form for ordinary people to follow us, because it's very difficult for average person to, it's mind-blowing, so that everyone can understand it. Maybe just put it in, I don't know, point-wise or whatever.
I can help with that.
Yeah, it will be, because there are so many people with these diseases and it's increasing.
Yeah.
It's I've made presentations about Parkinson and Alzheimer's, so if you need help, we can set up just something and work it out and let it check that we don't make special. But I'm really looking forward to help with these things, probably translate it into Dutch or English.
In Dutch.
I understand where you're coming from.
Yeah, and obviously, Rob, as you can know, sometimes there is a gap between scientific language and common language, right? That is not always easy.
Yes, yeah.
Yeah, so I mean, probably we'll take advantage of your expertise, and probably I can even provide you Dr. Trainard's slides, and you can kind of look at it. And
we can give it a try. And I did a lot of that kind of work for another company also in the past. So, let's make it, from my point of view, let's make it a project and see how we can try it out. And if you can reach a bigger audience, it will be beneficial for us all.
Yes, and make it easier for people to understand. Otherwise, they just say, oh, well, it's too difficult, I don't understand it. you know, and you don't want that. You want them to get excited about it.
I think Hanneke, she has a question as well. At least I see her hand raised. Hello, Hanneke.
Hello. I didn't see the whole presentation, and I was wondering how can these products help people with example cancer treatments and so forth.
So for cancer, we don't have clinical studies. We have only we just have some testimonials. But so about some improvement in when it's taken outside the chemotherapy session, but it's only testimonial. So about the fatigue, all the side effects of the chemotherapy. We don't have, I would say, clinical data for cancer specifically.
Yeah.
Okay.
Based,
Because I was thinking people who get chemos or radiation, those cells are being killed,
Mm-hmm.
precisely.
and when we use these products, it duplicates the stem cells.
That's
So
very,
that's why I was thinking how could this be beneficial for those people?
and that's a good thinking because based on all the cases that we've been having across the time, the benefits they came more on the remission time. So after the treatment, when people start really get on remission and recovering from it, that's when really we can see some positive effects of of using the products. You know, I mean, this is not clinical again. I want to underline this. We didn't do specific clinical studies on that, but based on empiric knowledge that we take from, because of course, as you can imagine, across the years, we have endless cases of people with different kind of cancers. First of all, it depends on the kind of cancer that we're talking about. It depends what kind of treatments was adopted to deal with that, operation or not, chemo, radio, whatever. But overall, what I would say here is that where we really see great feedback and good points is on the remission stage, where people are really recovering from it on the following 3 months, 6 months, and all of that. Precisely, I imagine because of that reposition of cells and regeneration that starts to be made after. Correct me, Veronique, if I say something stupid. You have the
No.
knowledge, I have the empiric one, right? But yeah, that's what I can tell you, especially there, right? On the rest, you know, we have also people that showed improvements on previous, but I mean, it's too risky to say something like that. It's too risky to say that we can really do something about it on the moment before the treatment. So I would say let's let the science do the job, you know. But after, on the recover stage, yes, I think it can have a very positive impact.
Yes,
Yeah,
I
well,
understand Hanneke's question because we get questions from people who say we're not going to advise this because it can even lead to a growth in cancer cells. So that's what you sometimes see on the internet about stem cells. So that's why I think it's good to address this.
Yes, but we have a preclinical studies on this. We have on preclinical study. It's a model of human breast cancer that were transplanted in a rodent model of, and in fact the consumption of stem cell of stem cells sorry, the consumption of stem cells didn't increase the tumor, so it's not promoting cancer cells. That's the objective of the study was really promote these things. So we didn't say that it's cure cancer, but it didn't promote the tumor growth and cancer cells.
Well, I'm learning the 5 biological laws, and cancer is the most less understand illness people have, because cancer is to help the body, the organs. Only it's for a short time of period. Those tumors cells should be made, but we are thinking and being scared, so it goes on and on and on and on, and then it gets dangerous.
Yeah.
It could be dangerous. So if I get the prognosis of a diagnose cancer, I will be very thankful for my body because it's keeping me safe. It's a different way of thinking, but
Absolutely. Absolutely.
I know that many people are not thinking the same.
Yeah. Well, and I think one interesting thing that we heard here today is like we have preclinical studies that shows that there is no negative effect in taking the product. So that reassure us that there's nothing to lose. People won't suffer any damage by taking it. It might not solve the
It's good to know.
problem, not, but doesn't. On the other hand, also we need to be careful because usually cancer patients are people that are psychologically very affected, as we imagine. They are desperate in many cases, and they are looking for a miraculous solution, right? For something, a miracle that happens and that takes it away. I think it's important in common sense on our side, or not to raise fake expectations to people with cancer things. However, if the people are willing to try, we don't see any. There is not any adverse effect. Okay, so that's reassuring. And and then we'll see. Everybody's a body. Every reaction is a reaction. So let's look at every case, but I wouldn't actively promote it on this direction. I would put more the focus, as I said, in cases, successful cases, where people were submitted to a treatment, where that treatment was apparently successful. We never know before 5 years, as you know, but it was apparently successful. And these people, they need to recover now from all the treatments and all the process they were submitted. And probably that is the right stage really to come with the products. Okay. That's my opinion. Again, Veronique, if
No, that's true.
Yeah, correct me. All right. Any other question? No, we are good. Okay, so thank you so much for your presence. We did several. Today was about neurodegenerative diseases like Alzheimer and Parkinson, but we did it in the past about feminine health, for example, and diabetes, and so many topics that we had so far. So I advise you to look in your back office. You will find recordings of previous sessions that we had. At the same time, of course, we will come with more in the future. So stay tuned and you will hear some more. Okay. Thank you so much for your time. I wish you a great.
You too.
Thank you, Dr.
Thank you very much. Bye.
Thank you.
Bye.
Bye bye.
Thank you, Veronique. It was a pleasure again.
You.
Okay. Bye, everyone.
Thank you.